All right, let's get into what's been happening throughout the day. Now, a mass COVID-19 screening operation is currently taking place in Umlazi in KwaZulu-Natal. At least 210 households are expected to be checked. Now, KZN Health MEC, that's Nomagugu Smelani Zulu, has joined officials in the area. And our reporter Tuba Vilane is there and joins me now just for a quick update on what's been happening, of course, throughout the day. Tuba, good afternoon to you. You have been, of course, following the MEC as, of course, she continues with these mobile screening and testing throughout Umlazi. But how's the screening coming along?
Yes, thank you so much and good afternoon, Tumelo. Yes, we've been walking around Umlazi Q section with the MEC of Health, Nomagugu Smelani Zulu. She started at the house of an 81-year-old woman that sadly passed away due to the virus. And then she also went to other houses where, together with the officials, they are screening. And we understand that if there are suspected cases or symptoms, and then those people are then subjected to the testing. But we understand so far in the few houses that the MEC went to, there were no symptoms that were found on those people. So it was basically screening and educating people about the spread of this virus. As we're speaking to you, there is a car that is driving around the township, educating people and encouraging them to adhere to regulation, the lockdown regulations. But we also spoke to the MEC herself. Maybe let's listen to her explaining.
The screening team gets into the household, and the household members of the household are asked several questions. And some of these questions will relate to the symptoms, whether they have any of the symptoms that, two or more of the symptoms that are relating to the virus, a history of the patient, have they traveled, have they been in touch with anyone who has traveled, have they been in touch with anyone who actually has the virus. And that's the kind of questions that then decides whether people or one person in that household must eventually be tested. Then once the screening team has concluded, it moves on and indicates to the tracing team, which is the team that actually tests. Now, the tracing team is the team that has your professional nurses and other ones who are actually conducting the tracing. So if in that particular household there's no one who has any of two of the symptoms or more, and has not have any history, no one is coughing or sneezing and so forth, then they move on. But if there is anyone with such symptoms, then the tracing team comes in and actually tests.
Now, Tuba, I want to bring to the attention, the issue of protective gear for medical staff who are at the front line working with people during this pandemic, because Nahal has also raised this issue and even said they are even thinking or rather considering taking the Department of Health to court for this. But, I mean, what did the MEC then have to say about this lack of protective gear for medical staff within the region?
Tumelo, maybe firstly let me talk about where we are. From the officials that are traveling with the MEC here in Umlazi, I can confirm that we have seen them. They are all wearing their protective gear, but we'll understand that there's been a serious concern from workers. Even yesterday we spoke to some unions that include DENOSA, SAMSA and PCA. They were all raising concerns about protective gears being not available in some health institutions, and they are even saying should the department fail to provide these very basic requirements for them to enable them to perform their daily duties, they will then ask their members to come to work but not to perform any services. But the MEC obviously is saying, as the department, they are faced with a serious shortages that is facing the world. But let's listen to the MEC explaining.
this protective gear is shot not just in KwaZulu-Natal, not just in South Africa, in the whole world, because this is a challenge that is faced by the world. Of course, we are getting our orders that are being delivered in drips and traps, because some of them are able. Now that China has actually lifted the lockdown, they are beginning to manufacture some of the things that we have requested, and they are coming. What we have decided as the province of KwaZulu-Natal is the distribution of the protective gear, and we are giving that responsibility to a district director. The intention of that is so that at least the district director will have a bird's eye view of which facility needs more protective gear and is able to remove the protective gear in the facility that is not needed, so it will be spread around properly.
All right, thank you so much. Our reporter Tuba Vilan, who's in Umlazi in KwaZulu-Natal, updating, of course, on MEC Nomagugu Smelane Zulu during those mobile screenings within the region.